Hey there, welcome to today's video on understanding bone marrow transplant and recovery. If you're watching this, you or a loved one might be going through this challenging yet hopeful journey. Let's break it down step by step. First off, what's a bone marrow transplant? Simply put, it's a procedure where damaged or destroyed bone marrow is replaced with healthy bone marrow stem cells. This is often necessary for patients with certain cancers, blood disorders, or immune deficiencies. There are two main types of transplants: autologous and allogeneic. In an autologous transplant, you're your own donor. Your healthy stem cells are collected before undergoing intensive treatment and then returned to your body. In an allogeneic transplant, the stem cells come from a donor, who could be a relative or an unrelated match. Now let's talk about the procedure itself. It starts with a conditioning phase, where you'll receive chemotherapy or radiation to destroy your diseased marrow. This can take several days. Then the transplant day, often called day 0, arrives. The new stem cells are infused into your bloodstream, similar to a blood transfusion. Recovery is a marathon, not a sprint. The first few weeks post-transplant are critical as your new cells start to engraft or grow in your bone marrow. During this time, you'll be closely monitored for complications like infections or graft versus host disease. You'll also need to make some lifestyle changes to support your recovery. A balanced diet, regular exercise, and avoiding exposure to germs are crucial. Your immune system will be rebuilding itself, so meticulous hygiene and following medical advice are key. Emotionally, this period can be tough. It's normal to feel a mix of hope, anxiety, and even frustration. Connecting with support groups or professional counselors can be incredibly beneficial. Remember, asking for help is a sign of strength, not weakness. Long-term recovery varies for everyone. Some patients bounce back quickly, while others take months or even years to feel fully recovered. Regular follow-up appointments and staying in tune with your body's needs will help you navigate this journey. In conclusion, a bone marrow transplant is a complex but potentially life-saving procedure. Understanding the process and preparing for recovery can empower you to face each step with confidence. Stay strong, stay informed, and take it one day at a time. Thanks for watching. If you found this video helpful, give it a thumbs up and subscribe for more health-related content. Take care.